So, Dr. Carter,
Yes.
let's have a conversation today about COVID-19. And I think most importantly, why don't you tell the audience a little bit about your background and what gives you the credentials to discuss this topic in great deal?
Well, I started out as an anesthesiologist, did that for 16 years, then migrated out of that arena after retiring and went into the medical spa realm and then dove deeply into the functional medicine realm. I was one of the first doctors that became certified in stem cell therapies at the American Academy of Anti-Aging Medicine, and I've been a member there for probably the last 14 years.
Mm-hmm.
And one of the main reasons that I look to transition between all these careers is because I've had a personal problem with glaucoma. It was time to go into a different direction, but also to focus on looking at root causes for what was happening to me. So being on the traditional medications and having the traditional surgeries and so forth, it became very frustrating and evident that I was basically on a course that was not going to help reverse this. And of course,
Right.
The traditional ophthalmologists were stating that you can only just slow the process down with the medications and so forth. So then after that, really kind of delving into the functional medicine arena, identifying numerous things that were occurring to me as well, and addressing those from a functional medicine standpoint, which is, again, that's root cause rather than just trying to address something with a medication or a symptom with a medication and so forth. What is driving the disease process? And that's what functional medicine is all about.
Can we transition on to the coronavirus? Because
Sure.
I know that's obviously a hot topic. I think there's so much misinformation and so much flooding of information, and also such sound bites of information. Can we maybe dive into a couple of questions? First of all,
Sure.
what is a virus? At the most basic level, and let's start there.
Well, I mean, so viruses are particles that really are non-living entities that can insert themselves into our DNA, and they have to have a host to replicate. Epstein-Barr virus, herpes virus, and so forth. Those are very common viruses. Epstein-Barr causes mono. So the vast majority of the population has been exposed to that. And a whole host of other viruses out there that, and all along the continuum of HIV and SARS and MERS, and of course now our coronavirus, our new entity that we are fighting.
Right, and the coronavirus is a generic term for a type of virus family, and the coronavirus is one particular. But from what I understand, rhinovirus and coronavirus are the major cause of just a regular common cold. Correct?
Absolutely, yes. So it's been with us, for eons. The problem, this is a mutated version of this virus that basically came out of those entities like SARS and MERS, SARS standing for severe acute respiratory syndrome, which is all, connected with the lungs and problems with the breathing and ultimately the demise of the patient. And we are seeing very similar type occurrences with this coronavirus and how it is wreaking havoc in people's lives.
So clearly anybody with something going on in their lungs, like an overlapping cold or even something like congestive heart failure, will make you much more susceptible, most likely
Absolutely.
with something like this? Yeah.
Yes, absolutely.
So what are the symptoms of this so-called novel coronavirus compared to, say, a common cold? And how can someone try to differentiate if they're at home and they're not feeling well, or is that even possible?
Well, I mean, it depends on, I mean, it has a fairly decent incubation period, up to 2 weeks. But the most prominent things would be a dry cough, non-productive cough, and high fevers.
Yeah, because
So,
normally a cold doesn't drive a fever, but for some reason this one does.
right, absolutely, absolutely. So anyone in that situation, seeing that, of course, we know that they ultimately need to be seen as soon as possible, especially if they are having an accelerated fever. So,
Right. Will someone feel symptoms before the fever sets in, or would be measuring your temperature every morning, say, and charting it out be a way to kind of like measure if you might be becoming infected by that bug?
well, it's hard to say. Again, with the vast majority of the population, um, it's more just regular cold symptoms and not necessarily, any significant fever or so forth. It is the grouping of the immunocompromised, the older population, and or immunocompromised that is being more significantly affected by this virus. And the symptomatology is just more apparent because the body can't efficiently fight it. So the first line of defense is our white blood cells and neutrophils to go out there, and natural killer cells to go out and destroy this
Mhm.
virus. But in scenarios where the body is busy doing something else, because there are other, let's say, subacute infections that are, by the way, are very, very common in our population.
Right.
And of course, you and I have elucidated that with several hundred patients that we're working with, and so forth, that people just had no idea that they had these infections. So if the body is busy fighting those infections, and let's say you have a periodontal disease, which of course is very, very common, and there are a whole host of bad bacteria and viruses and parasites that reside in our gums. So, which, by the way, also can be implicated in Alzheimer's and so forth. But again, if the body is busy fighting those infections, is it busy scavenging cancer cells? Because, of
Right.
course, everyone walks around with cancer cells in their body. But if it becomes overwhelming, then that's when it gets those cells become rogue and they start overtaking individuals. So again, if the body's busy fighting infection, it's busy fighting cancer cells, it's busy fighting toxins and so forth. Everyone has a bucket of toxins and so forth in their body
So,
that,
Carter, you're
yes.
bringing
So
up, I'm sorry for interrupting, but you're bringing up an extremely interesting point that I don't think a lot of people are covering. So, for example, out there's a lot of discussion about immunocompromised people.
yes.
And the only way they're measuring that is, do you have diabetes? Do you have heart disease? Do you have a significant chronic health condition?
Yes.
And that's it. But you're extending this to a much higher level. You're
Oh,
saying
absolutely.
a healthy person who is sort of on the edge of being sick but doesn't know it because their body is fighting on several different fronts
Hmm.
may also be someone who could easily succumb, not necessarily dying, but have severe symptoms, not just mild symptoms, if they are infected by this. You want to
Absolutely.
articulate
Absolutely.
on that a little bit? Yeah.
Yeah.
How,
And that's
how would you,
why,
how would
and
you in
that's
your
why,
practice measure that?
yeah, and that's why it's so important to do some of these elucidating tests, you know, early on to find out what is lurking underneath that is silently causing problems in your body.